The whole question of trachoma and gender really came up probably about 10 years ago when I think everybody understood that women did have a higher risk of trichiasis from trachoma, but we really didn't have a good measure. And so back in 2009, there was a very good study that looked at that and really found that women have an excess of like 1.8 times as much trichiasis as men do. That's been updated more recently, and now we have a better sense, and it's really closer to 2. So essentially, women have twice the risk of trichiasis compared to men, age adjusted. Now, what that says to us is that we have to make sure that our programs reach women because they are preferentially affected by this condition. And the good news is that many of the programs, if you look across Africa, are reaching women more frequently than they're reaching men. But this variation actually exists such that in Ethiopia it's likely that it's more than 3 times as many women with trichiasis as compared to men, and in other places it's slightly less. So when we talk about globally, we use the twofold excess, but at a national level there is some variation. The point of all of this is that we have to use that data better. We have to use it for making decisions, we have to use it for developing our programs, and we have to use it for monitoring what we're doing. Are we reaching women adequately? Program after program after program. Well, this whole question of why we see such a variation in risk of trichiasis in one setting versus another. We don't really understand the reasons why we see that variation. We have some suggestions. And so some of those relate to exposure, that within the household, women are obviously more likely to be ones responsible for childcare. Are there variations in setting to setting? Maybe that explains some of it. I think pretty much every setting we see a fairly similar prevalence in active trachoma, boys and girls, in terms of their prevalence of active trachoma. We don't see much difference. So it's likely not happening at that level. So we have to look at the whole differences in terms of gender roles, but we probably also need to look more in depth at immunologic responses. And there's been some recent research that suggests that maybe women, for biologic reasons, have a stronger, response immunologically, and that they may be at higher risk biologically for trichiasis and scarring as opposed to men. So we need to understand that better. In order to use this data that we have more effectively, I think that we need to probably take all that existing data that we have and really do a deeper dive into understanding that data. So we have a lot of data, for example, on follow-up, but we haven't broken it down sufficiently to look at follow-up for men versus women. We haven't really broken it down to understand if having a female case finder assisting women to come back for follow-up is important. What is the role of those interactions? So I think we need to take a deeper dive using our existing data to understand how gender roles and how our programs reach women better, or whether they don't reach them adequately with all these different services. We need to get more qualitative data. And so we have numbers, and that's fantastic, but we need a better understanding, and that's through qualitative assessments, an understanding of why people don't return for follow-up, why we don't have as good an antibiotic coverage in certain areas. And I think a lot of this really comes down to qualitative data collection, more so maybe than quantitative data collection. To me, they should be intertwined. They should be supporting each other. I think we've done a pretty good job of collecting program data. I don't think we've done as best as we could in terms of getting that qualitative data, because that's how we figure out why we do what we do. So the SDGs represent a huge range of not just goals, but activities and areas in which we as a global society need to put our efforts into. The fact is that looking at gender equity addresses so many different aspects. It addresses issues related to education, it addresses issues related to water and sanitation, it addresses issues related to universal health care. So the way I look at gender equity is it's such a cross-cutting issue. It crosses and addresses so many different aspects of the SDGs that every activity and every success we achieve in getting gender equity is going to have such a huge impact, throughout the entire SDG list of goals. So it affects education, it affects sanitation, it affects everything. So to me, it's a foundational SDG that we need to be fully engaged with and put adequate resources to really address.